All right, well, let's talk about facts and vaccines because you've been very positive about having a vaccine very soon. And I want to ask you about that. I don't know if you saw an article by the CEO of Merck, who he talked about that the vaccine hype is doing a disservice to the public. How confident are you, Dr. Fauci, that we're going to have a safe and effective vaccine within the next few months?
Well, I wouldn't say the next few months, but let me tell you what the timetable is. I wouldn't call it hype. I think what it is utilizing the current 21st century technology, platform technology that we have to really make advances quickly in ways that would have taken years before, that now takes weeks to months. And we've already shown that by going from the sequence of the virus in early January when it was put on a public database to go literally within days into a vaccine trial, because you could put it into an mRNA platform or another platform. And then 62 days later, enter into a phase 1 trial. That is amazingly unprecedented in every respect. Right now, we're going to go into a phase 3 trial at the end of July. And there are several candidates that are also lined up to go into a phase 3 trial soon thereafter.
At least 4 candidates?
Yes, at least 4. At least 4 that the NIH and the federal government is helping to subsidize and to collaborate with regard to clinical sites. So, I don't think that it's hype. It's real. There is risks that to be taking, but they're financial risks. They're not risk to safety. They're not compromising scientific integrity. So if things turn out the way we would hope they do, and whoever makes that comment is right, that you can never guarantee something, I would use the words that I'm cautiously optimistic that we're going to get there. Anyone who guarantees something when it comes to vaccine hasn't been involved in developing vaccines, because we know we can't guarantee it. But we can be pretty optimistic that we're on a timeline that we should know by the end of this calendar year, the beginning of 2021, whether we have a safe and effective vaccine. And looking at the preliminary data of immunogenicity from the phase 1 study, which showed robust levels of neutralizing antibodies, even with the moderate dose of the vaccine, again, makes me cautiously optimistic that we will get there. So that's something that I think we really don't think is hype. We think it's realistic, as long as you don't feel that you're going to guarantee something, but you're optimistic that we're going to get there.